Whoa, what happened there for a second? Did you hear that? It went out. Hey, 1, 2. Hey, check 1, 2. It is loud. I'll turn it down. Hey, 1, 2. Hey, 1, 2. Hey, check 1, 2. Hey, 1, 2. Hey, check.
Hey, 1, 2. Hello, 1, 2.
Hey, check 1, 2. Hey, 1, 2. 1, 2. Hey, 1, 2. Hey, 1, 2.
Now, why is he saying we're not expecting a huge crowd?
No, 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 it's not. You can sit anywhere.
You sit anywhere. Nothing is reserved.
Okay, I thought this was reserved.
Nothing is reserved. Everything's for you.
You know, I love the flying now because it was still a bit of anxiety learning. So you keep it. That's cool. I never quite got there. They do? Well, that's good. Yeah, that's good. I flew a lot when I was in high school. Oh, did you? I never got my last 8 hours off the engine, actually. Wow. Because my best friend in high school works for Goddard. He's a flight instructor.
Is the roll on? Okay. No, I think they're just going to go from here.
Taking some lessons, you know, some of them were there, and for whatever reason. Yeah, that's exactly right. That's a good point. Yeah. Well, but you know, the trouble after that was a good friend of mine. He was a lot closer. He goes, Bill, you know, it sounds exciting and sexy, but he goes, let me tell you something. The vending machines in the restaurants look the same as they do in Miami. But other than that, so I almost basically didn't make it where I was going to go. Oh, and then the plane broke once. Hello. That's reassuring, isn't it? Oh, yeah. Hello. Good morning. Hello, Paul. Hello, Paul. Hey. Oh, Chloe. Bill. Hello.
You are
Nice to have a friend.
turned on. Should be functional. You can test
There
it.
you go. See, man. So we know what we're doing and what we're not doing now, right?
Yes.
Okay.
Okay. You move to go out at 12:50 because of the classic one.
I got you. As usual.
That sounds like fun.
We won't be done. We'll pretend like we are. Well, good afternoon. Good afternoon. Good. Well, it's great to be here with you guys, and today we're going to be talking with Dr. Phil Saul, and as many people here know, but perhaps not everybody, Phil is a not so recent anymore. I did 2 years. Wow. To our WVU medicine team, And I can't remember exactly every title, but I think you're the Executive Vice President of Children's...
For Children's Hospital.
For Children's Hospital.
For Children's Hospital.
Well, really for the whole program with children and with Leo Brancazio, who's overseeing the women's program, we really want to grow our ability to take care of moms and children in a way that perhaps we haven't been able to do before. So Phil, I got to know Phil when he was the chair of pediatrics at Nationwide Children's Hospital in Columbus. And before that, he had trained in Boston. And in fact, he, I believe, if I'm correct, trained our own Larry Rhodes as a cardiac electrophysiologist.
It was hard.
Yeah,
but,
well, some people take longer to learn than
True.
others, yeah. But anyway, but Phil, like Larry, has a great heart and has helped a lot of children's hearts work better. And Phil's really not only a national, but an internationally recognized academic person, heart expert, and also leader in children's health and children's medicine. So, Phil, I don't know if you want to make a few comments, and I'm going to step back while you do that, and then we'll come back and have a conversation, and I'll use all the embarrassing information that his wife Amy told me about. So,
okay.
Stay tuned.
So I see a lot of familiar faces, and some of you have probably heard some of the things I'm going to say, but I'll just talk a little bit about what our vision and mission are for Children's Hospital. And here, first of all, I want to make it clear to everybody that when we say Children's Hospital right now, we really mean everything that has to do with delivery and children. So women's health that's related to obstetrics, minor gynecologic procedures, are all included under that rubric of Children's Hospital. We're going to change that. We're going to make sure that the name recognizes the fact that women are an important part of the hospital, but right now that's what children's means. And you hear a lot, Albert speaks, Clay speaks, you hear a lot about what the health system is doing. To a large extent, Children's Hospital is really a reflection of the overall health system. And what I mean by that is that the mission of the health system or of WVU medicine is really to take care of every patient, every man, woman, and child in this region and in the surrounding counties that needs us. And that can have a lot of different definitions. It can be because they live near us, or it could be because we provide a service that other people don't provide. And I would say that we're just an echo of that in children's. Just substitute women and children's, and you've got our mission and vision. So how are we doing that? And here I think it also reflects the overall mission and vision of the institution. We want to provide a combination of sick care. We want to provide the best possible care that the patients can come to us can get if they have congenital heart disease, if they have cancer, if they have asthma, if they have diabetes. We want to make sure that we have a level of excellence that is equal to anywhere else that they can go. If we don't provide that level of excellence, something like solid organ transplant, right now bone marrow and heart transplant for children for sure, then we're going to find them the best place that they can get it. And there are good places around here. There's one about 80 miles north that happens to be a world leader in transplant. So there are things we shouldn't do, but the things that we do, we need to be the best that anybody can be at it. So excellence is a goal. The second half of that comes under what is child health. And child health is clearly more than just taking care of people when they need us, either for subspecialty care or in the hospital or for their vaccinations if they're our patient. It's really about helping people be healthy. And this state, as I've learned, Clay and many of you are West Virginians. I'm not. I'm adopted West Virginian, like Dr. Gee. You'd think he was a West Virginian, but he's from Utah. But this state has a lot of challenges. I'm not saying anything new to anybody. We have cultural issues in the state. We have health issues. We have education issues. We have financial issues for families. So there's a huge number of challenges, and keeping people healthy is more than just taking care of them when we're sick. And I'll talk about how we plan to approach that, but that's clearly part of our goals. So these population health, value-based medicine strategies are important to us. So what have I been doing in the last couple of years with the people in this room and with the leadership and with certainly everybody who's involved with Children's Hospital? And the number one thing is that we're filling gaps. And we had a lot of gaps. The primary gaps were not having enough of many specialties, not enough pulmonologists, neurologists, gastroenterologists, so, or having one of something. So Dr. Gustafsson, who can't tell if he's in the room, he's probably working on patients, was the only pediatric cardiac surgeon here for 35 years. What happens when Dr. Gustafsson's away? We don't have pediatric cardiac surgery. That's clearly not a way to be a resource for the state when it comes to that kind of high-level care. It worked pretty well for those years, but we obviously need two people. And so we hired another pediatric cardiac surgeon. We can't say no, just like the whole hospital doesn't want to say no when patients need to come. We needed adequate pediatric intensivists, neonatologists. We've covered that. We didn't have an interventional cardiology program for a while. We now have that. I mentioned a number of specialists, pulmonary medicine, neurology, gastroenterology. We have new specialists coming in that area. Been a lot of press. Dr. Mike Ost, who was head of pediatric urology at Children's Hospital in Pittsburgh, vice chair of urology for all of UPMC, as of September 1st, works here. He's now our associate surgeon-in-chief, and in July, he will be the surgeon-in-chief for Children's Hospital. We have a third orthopedic surgeon. The two we had, Drs. Libicki and Grant, were doing an amazing job covering trauma every other night, but that's not really sustainable. We have a third pediatric surgeon since I've got here. We have a fourth position open. So we're basically trying to fill the gaps so that we can both take care of everybody who needs to come here. I see Dr. Ramadan up there. He's got a partner, Dr. Michelle Carr. First time we've had a second pediatric ENT doctor in a long time. So we want to be available when people need us, and we need to be able to lower the access. So it can't take, I think Albert, I heard say this morning, you know, if it's over 100 days to get an appointment with a pediatric neurologist, if it's his kid, he's not waiting. And probably neither are any of you. You're going to find another place for it. So we need to be able to provide that access in the same kind of goals that the overall institution has. 15 to 20 days is fairly reasonable. Once we have that access filled, we need to move it around the state, because what we've learned is that there aren't enough specialists in pediatric specialties anywhere in West Virginia. And so we've formed an alliance with Children's Area Medical Center and Huntington Marshall Children's Hospital Collaborative so that we can work together on things like quality, advocacy for kids, and clinical programs. Say, share 6 pediatric surgeons for the whole state instead of having 3 different groups that aren't sustainable. Get one group together that's more sustainable. In addition, we do a lot of outreach. We have about 20 outreach clinics now. We need to expand that. As everybody knows, we've got Martinsburg is far away on the eastern panhandle. Got the northern panhandle. For us, Huntington is very, very important. That's where most of the patients who leave the state from a pediatric standpoint. So expanding our capabilities through both in-person outreach and telemedicine is very important. The data is that 20% of the discharges of West Virginia's pediatric patients occur out of state. 20%. It's about 2,000 discharges. Probably 1,200 of those go to other children's hospitals. Cincinnati Children's, Nationwide Children's in Columbus, Pittsburgh Children's, DC Children's. About 40% of those just walk across the border to Marietta or Winchester or somewhere like that because it's more local for them. That's we're not so worried about. But we do want to provide an opportunity that every West Virginia child or mother who needs care that they can't get locally can come here. That gets to the notion of a distributed women's and children's hospital. So I think everybody in this room is familiar with the WVU health system, and it's grown enormously, and we've benefited from the expertise of Albert Wright, who was in Pittsburgh and a big health system and kind of learned how to cut his teeth on a health system, and Clay, who's got big vision, and Gordon, whose vision is so big that none of us can capture it. So the system has almost doubled in size in terms of affiliations, and since I've been here almost exactly 2 years ago, and there are 40-something pending between practices, hospitals, et cetera. So there's a lot going on, and the goal of that health system is really to form a network that really densely covers at least everybody in the upper half of the state. So what we want to do for women and children's is have a distributed women's and children's hospital so that if you're in Martinsburg or you're in Parkersburg or you're even at Clarksburg, and you have a baby that needs a little bit of care, that needs some oxygen, maybe 4 or 5 weeks early, that has neonatal abstinence syndrome, that has a little bit low blood sugar. And in the past, the pediatricians who don't really want to be in the hospital anymore and don't have time might have said, transfer them to WVU. We want to make sure that those babies can stay closer to home. So what we've done is we've actually, at the request of these places, taken over the pediatric and newborn inpatient care, delivery room, newborn and pediatric care at Raleigh General Hospital in Beckley, Camden Clark Medical Center in Parkersburg, now Fairmont General, and even the Mon General. I think we're probably the only kind of sustained clinical program, clinical affiliation with the Mon General right now. It's good for kids, it's good for mothers, it's good for families. And if we do it right, we'll keep a 34-weeker, 32-weeker in Martinsburg who can be near their mother, and when they need surgery, whether it's heart surgery or general surgery, ped surgery of some sort, they'll come here for that care. So in planning a new hospital, which we're getting very close to, what we're trying to do is make the beds right so that we're anticipating keeping patients out of the hospital and bringing other patients into the hospital. The last thing, or a couple of more things I wanted to talk about, was one is a quality program. So one of the gaps we had was when I got here, the US News and World Report does a computer IT pull of all the data on the adult side. And so basically everybody's in that report. And this, we did very well. I see Dr. Alamar is here, so urology was ranked 26th, 24th this year, which was the first time we've had a program ranked. But on the children's side, it's a manual completion of the survey. It's a lot of work. And you'd say, well, you know, are we going to be #1 in pediatric urology? We got Osama here. Now we have another one. Maybe not #1, but we could possibly be ranked. But the most important thing about that survey is it's a metric. If you don't measure what you're doing, you're probably not doing it as well as you can. So we've made a big effort to resurrect that survey. Jen Wenball from the quality department is now full-time children's. We have a quality council that Rich Brandt runs. And we're now the paradigm quality council for the whole institution. There will be quality councils like ours, like the Women's and Children's one, in every area of the hospital. We've got all the medical directors, we've got nursing leaders from each area, we've got pharmacy, pathology, we've got every aspect of the hospital involved. And that quality council is looking at the gap analysis. One of the things it's doing is looking at the gap analysis from that US News survey that we filled out this year. We came close to being top 50 in a couple of things. We thought we might make it in a couple of things. Heart for one, so we came close. But they're looking at those gaps and saying, how can we best fill in those gaps so that we can do what I said in the beginning, which is provide a level of excellence that the people of this state deserve from this hospital. The last thing is, I mentioned a new hospital. We're getting close. We got a location. It'll be next to the HVI. We've got renderings. They're not final. We've got layouts of the floors. We know what the footprint is. It's not big enough, but we're going to live within it. We know how much we need to raise. It's a lot of money, about $60 million. But there will be a formal announcement, hopefully in the next few weeks, with final approval. And what that will do is two things. We didn't even have to financially justify it because the hospital needs 130 more beds. And just by chance, we need 150. So it worked out really well. We get a new hospital, the hospital gets 130 beds. And then the second is that it turns out Children's actually does okay on a pro forma basis. So we look good, but from my justification, it was very easy. The institution needs more beds, and it needs a new face for Children's. Needed updated facility, and so we're going to get that. So I'll stop there and let Clay embarrass me.
All right.
And
Good.
be happy to take questions after.
Yeah, and so we would really love for you guys to also come up and ask questions of Phil about what the future looks like. I want to just recognize Bill Neal, who's in the audience. So Bill and I yesterday had the pleasure of being in Washington, D.C. together. And Bill is the president of the Familial Hypercholesterolemia Foundation. and they were recognized with an award yesterday from the National Forum on the Prevention of Heart Disease and Stroke. So please congratulate Bill with me.
And Bill tried to retire, but I hired him back to work for children, so.
Yeah, Bill can't retire, but he already knows that. So we had that conversation yesterday. All right, so Phil, talk to me about your most recent passion, which is flying an airplane.
Yeah, well, Bill Ramsey was just quizzing me on that, so.
I think there's 3 things a life insurance policy asks you, by the way. Do you fly your own plane, do you climb mountains, and do you parachute? And I think there's maybe
Scuba
a reason
diving.
for that. Is it scuba diving? Okay.
Yeah. So, so first, when Clay asked me to look at a job here, I think I had the answer a lot of West Virginians did is, no, I don't want to move to West Virginia. I'm here, though. But one of the things I recognized when I got here is we have very poor air service. Anybody who's tried to take a plane out of our airport knows they don't go all the time. You get stuck at Dulles. You get stuck here. You have to get in your car and drive. I just heard yesterday Kathy Moffett said they drove to Maine recently, and they had driven to Boston before. So
To get a plane?
to get up, because their plane didn't go. So a lot of us go through Pittsburgh now. So I have a home in South Carolina. I'm here. I work here full time, but I have a home in South Carolina. And what I realized was that it was just hard to do that. And like a lot of people, I thought it might be interesting to fly, but I had a good reason. And started taking lessons in March of 2016. I compared it to learning to be I'm an interventional electrophysiologist. I compared it to learning to do what I do at age 61. You wouldn't do that. I wouldn't have. I would have said, no, I'll see patients in clinic. But I was motivated and learned to fly. I got my license last September, bought a plane in November, and got my instrument rating in February. And now I found I fly more for work than I do for, I don't have Gordon's plane like you do to fly around in. So I've even gotten a few people, Rich Goldberg and I flew back from very southern edge of the state, looking down at the people in the van in a 2-hour traffic jam. So it's very convenient. And my plane has a parachute in it. The entire plane has a parachute. I show.
Which you haven't had to use yet.
Have not had to use. You don't want to. It's an $18,000 parachute pull.
Well worth the price if you'd have to use it.
So yeah, it's been a new passion for me.
Talk to us about landing in Philadelphia.
So there are a lot of anxiety.
Wait a minute. Now, have you guys heard the story of Harrison Ford? Okay. Talk to us about landing in Philadelphia.
So you don't want to be a Harrison Ford. And it turns out that for me, and as I found out, the very hardest thing is new airports. Because your own airport, you know where it is, you know where the lights are, you know where the runways are, you know where the taxiways are. Of course, Harrison Ford did it at his airport, so not going to go there. But and so one day I needed to go to Salt Lake City, and I decided I'd fly to Philadelphia, catch the plane there because I had to be in Pittsburgh, and then I had people to visit in Reading, Pennsylvania. In Pittsburgh, I made a taxiway error that I got called to the FAA for. Minor, no danger, but
Another mark on the permanent file.
well, it turns out no. It's like getting caught with cigarettes under 18. It goes off your record. So a little bit anxious, and then I knew I had to go to Philadelphia that night. So I left Reading, and immediately you get picked up by air traffic control in Philadelphia. I'm in the clouds, and I can't see much of anything, but I can see on my display there are planes all around me. Lots of planes. I've never been anywhere with this many planes. And when there's a double check, just like we're supposed to do in a lot of things in medicine. We don't always do as well as we should, but with air traffic control, there's always a double check. They tell you something, you repeat it, and if they're busy, you don't have time to say again, which you do at Morgantown Airport. So as I get closer, my air traffic control guy is controlling probably 20 different planes. And I'm hearing, American, 257, do this. Southwest, right turn, 15 degrees. And then he'd come to me, N23 Bravo Charlie, right 15 degrees. So, so I'm listening hard. I got everything right. Eventually got there, didn't make any turns in the wrong direction. I often confused my right and left. So, and then I popped out of the clouds, and the guy says, okay, you can't land until you tell me you see the airport. So I'm at 3,500 feet, about 5 miles from the airport, and he says, tell me when you got the airport in sight. Well, Philadelphia airport's huge. You'd think, how can you not see the airport? But sometimes when you haven't been there, you pop out. So it took me about 15, 20 seconds. I saw the airport, landed. He said, keep your speed up, which told me there's a plane right on my behind coming in. But I made it, and taxied in. So
Excellent.
I'm still here to tell the
All right,
tale.
that's good.
Yeah.
That's good. And we need to have you safe and sound. So that was probably a good experience in hindsight.
Good learning experience.
Good learning, yeah. We say that a lot, don't we, in medicine? All right, so tell me what your favorite places to go here in Morgantown are.
Oh, that's a good question. I think the first place I had dinner was Table 9.
I see you there a lot when we go.
I live there. I live in Waterfront Place in a condo, and Table 9 has burger, beer, and bourbon. Who's been to burger, beer, and bourbon? Okay, yeah, half the room. So I've been to burger, beer, and bourbon every Tuesday night that I'm in town. It's probably 90 times, maybe a few less, 80 times. And there's a group that goes every Tuesday night. Mary Lynn, is she here?
I think she's in New Orleans.
Yeah, so there's a group of us that love beer, and it's $15. I'm not trying to advertise because it's pretty full now. But it's a good burger, you get good French fries, beer and bourbon. That's one of my favorite places to go.
Good. Tell me about the Phils.
The Phils, yeah. Never had so many people named Phil. So who shops at Daniels? A few of us, okay. Phil Mauser now runs Daniels. Saul Radman sold him Daniels. Saul and I have become good friends. Phil and I have become friends. So they're Phil Saul, and I'm Phil Saul. Then we've got Phil Conley, who's on our leadership council. He'll be here this evening. He's a businessman in town and has been a big supporter of the university and the hospital. So we call us the three Phils when we're together. Yeah.
Excellent. Tell me what's your favorite vacation place?
Hands down, we have a cottage in Maine on an island called Vinyl Haven. It's just off the coast of Rockland, Rockport. You take a ferry or you can fly in a little bitty plane. And it's spectacular in the summer. It's like today. Every day is like today in the summer. It's awesome.
Good. And how about your family?
I have a wife of almost 36 years, Amy, who comes back and forth from South Carolina.
On your plane?
She now will fly on the plane. She doesn't like it.
That's an important mark of high quality, I have to
She's
say.
recognized that it's so much easier to fly on the plane. She's constantly having airport trouble. And I have two children, Davis, who's 26, who is working in France right now where his girlfriend is. He was an au pair for a couple of years, went to Pomona College. And a daughter, Lillian, who is 21 and at Wesleyan College and is a lobsterman in the summer. And she's a sternman on a lobster boat, and she's a strong woman. I see a lot of strong women in this place. So I'll tell you a great story from just a couple of days ago. Did anybody know it was Boss's Day on Monday? So my assistant Lindsay knew it was Boss's Day, and
There's apparently a holiday every day by the Hallmark Company.
yeah,
by the way.
that's what my wife always says. Hallmark holiday. They want to sell more cards. So they didn't get a card out of her, but they got. I like Diet Coke, and I like to fly, and she found online a plane made of Diet Coke cans. So it's really cute. If you come into my office, it's hanging in there. So I sent a picture of it to my daughter and said, look what I got for Boss's Day. So she says, wahoo, Boss's Day? What the heck is Boss's Day anyway? Don't the bosses always get the good stuff? You're the boss. What is that, white man's recognition day? So
Your daughter is not only a strong woman, but a smart woman, too.
Smart woman,
yeah,
yeah.
exactly. Talk about your most embarrassing medical moment.
So many years ago, when we started doing catheter ablations,
And explain to people what catheter ablations are.
so catheter ablation is using the tip of a catheter to heat or freeze a critical area of the heart muscle that's responsible for sustaining an arrhythmia. And it turns out that for many years we treated arrhythmias like neurologists treat seizures. Drug 1, drug 2, drug 3, except we'd put people through a catheterization to see if the drug was working each time. So in late 1980s, the first human catheter ablations were done using radiofrequency energy, where you heat small part, just a pea-sized area of the heart muscle, and it turns out you can cure most sustained monomorphic arrhythmias that way. So we did the first one of those in a child in 1990, and we didn't know how to do it the way it was being done, which was retrograde through the aortic valve. We were like, why would you do it that way to get to the AV groove? So we know how to go transeptal, so we did a transeptal procedure. And
Basically means penetrating the heart, right?
exactly, you take a long needle, you go across the wall from the right atrium to the left atrium, and then you pass a sheath over that, and then you put the catheter through the sheath. It's called a transeptal needle, is the long needle. And it sounds more dangerous than it is. It's actually pretty safe when you know how to do them, and pediatric cardiologists. So we started teaching the adult cardiologists how to do transeptal procedures, because they said, yeah, that's kind of a good way to do it. So I was doing a film for St. Jude Medical. DAIG was the name of the company then, and I'm showing people how to do a transeptal procedure. And while I'm doing it, I'm talking to the camera and probably paying less attention than I should have. Bill's been on the plane with me when that happened. So I look in the heart. There's air in the heart. There's not supposed to be air in the heart. I had injected the air from the needle. The patient was fine. You just give him nitrogen. Give him high levels of oxygen to get the nitrogen out. So I said, stop filming. Let's pay more attention to the case. So that's my most embarrassing
Very good.
moment.
And the person did okay.
The person did
kid
okay. The patient was absolutely fine.
Good. Talk about the people that work in the children's program here at WVU. Talk about their talent and talk about their culture.
So I think whenever you go to a new place, you really don't know what it's going to be like. I knew Clay, knew him from Ohio State, and got to know him even better. And coming here, I got to know Gordon, I got to know Albert, I got to know Judy. So I came here for two reasons. The leadership really attracted me, except for Laura. No, Laura. Just kidding. I got to know Laura Gibson too, and she was great, and is great. So the leadership really attracted me, and the mission is so strong here. So it's really different from other places. What I also found is that we have an amazing number of really good people. So I mentioned Gus Gustafson, 35 years, only cardiac surgeon in West Virginia, doing a lot of state-of-the-art stuff over those years. Larry Rhodes, who got really, really good training, really excellent training.
Who trained him, by the way?
Oh, yeah, I don't know. So Larry Rhodes, I knew, was one of the draws for me here. Chuck Mullett, who's been interim chair. I think I saw him up there somewhere. There he is, over there. And I got to know Bill, who, not an active clinician anymore, but an amazing leader and an amazing partner. And there are people throughout the hospital. We haven't had enough of them. So when I said we've been recruiting more, it's not replacements, it's additions. We've got a lot of really good people who are doing an amazing job and working incredibly hard. GI, neurology, they're doing everything they can to service those populations. We just need more of them.
Talk about the grant that you received for the Children's Network.
So Laura and Sally Hodder wrote me, I'd been here 2 weeks maybe, and they said, hey, Phil, you have to apply for this grant right away. And of course, you have a lot to do when you start a new job. There's a little honeymoon, but you have a lot to do. But as I looked at it, it turned out that we're one of the IDEA states, the Institutional Development Award states, which means we're special in a negative and a positive way. We're negative because that means we don't have as many federal dollars and grants as other states, but it also means we get a big boost up. For everybody in this room who does research or wants to do research, you need to know about all the IDEA programs because there are lots of opportunities. And one of them was that the National Institute of Health was putting together a pediatric clinical trials network to replace the failed National Children's Health Study. And part of it was what was then going to be a 15-center network of these IDEA states. There are 23 of us. I'm pretty good at math. 15 out of 23 seemed like good odds to me. And it turned out there were 17. So we applied for that. And what it's meant to do is bring clinical trials, protocols, sometimes surveys to rural and underserved populations. So there are three things we're focusing on right now, four things actually. One is kind of a training protocol, but one is what's called I Am Healthy. It's to see if we can coach people for managing weight control remotely through iPads, again, for rural and underserved. The second one is a vitamin D study with asthma and obesity. So it turns out that vitamin D levels are often low in obesity, and it may contribute to asthma. And then the third one is for what I learned is no longer called neonatal abstinence syndrome, but is neonatal opioid withdrawal syndrome, defining the baby more than the mother. And we're going to do a protocol to assess the needs for neonatal abstinence management, which is huge in this state and really gets to that point I made earlier about distributed women's and children's hospital. We need to figure out how to keep those babies closer to home, use the right protocols, give them the right care, make sure their mothers are with them, make sure their mothers breastfeed, but at their location. Because taking a mother that's already socially compromised and trying to get them here with their baby is not going to work well.
Talk about the opportunity for prevention in children related to the long-term health issues that we're seeing in the state of West Virginia or even in the country.
So, of course, the number one problem in children is trauma. And it far outstrips everything we do for high-level specialty care. And having come from South Carolina, with an interim at Ohio from here, we have the same kind of problems. People riding ATVs without their helmets, don't have their seatbelts on, just basic trauma prevention in the schools. So there's an enormous amount we can do. We do have a trauma prevention center here that's tied to the CDC. That's part of our Pediatric Clinical Trials Network proposal. We don't have many specific programs with them, but we want to. Number two, the biggest one is vaccinations. And this state's actually good on that.
When kids go to school, but before that, we're not very good at that.
That's true. So what we're trying to do is provide access to vaccinations everywhere, make sure they have it, make sure that there's education, and we've started, I mentioned this Children's Hospital Collaborative, so we joined the West Virginia Hospital Association this year, and we tasked Joe Letnelchin, who's head of that association. He kept saying, we need you in here. We said, okay, Joe, prove we should be in here and help us proactively make sure the legislature understands the issues with vaccination and is ready to fend off any attacks on our vaccination programs.
Let's stop there for a second and maybe explore this a little bit more in depth, because there is a lot of concern from certain people and certain organizations that childhood vaccinations aren't really safe, and there's a whole number of concerns about having children immunized. Why don't you talk about what the data is, what the science is, and the role of vaccinations related to the public health of children and of the health of our country?
Sure. So, there are a few kind of all aspirin or alike things. Vaccinations cause autism. There is overwhelming data that vaccinations don't cause autism. They're not related to autism. Autism happens, seizures happen, vaccinations happen. Many of those things happen at the same time in life. Doesn't cause it. In addition, though, the bigger issue is when you look back, the diseases that we vaccinate for, measles, mumps, rubella, just the basic ones, pertussis, tetanus, and then you add in hepatitis and Haemophilus influenza and other things that we now vaccinate for, and for us adults, for pneumococcal. Those things were major polio. We've eliminated polio, but those things were major public health hazards. I mean, there was an entire ward at Children's Hospital in Boston with iron lungs in it to treat people with polio. It was a whole unit, and most of those patients recovered somewhat, but didn't ever get full function. So many of us know an adult who's about 67, 68 now, maybe a little bit older, who was either right on the edge of polio vaccination or didn't get it and had polio and still suffers from those things, or we had somebody in our family. So this isn't sort of child's play in a way. This is really important. And every time vaccinations drop down, there's an epidemic of that disease. Measles, there's one in Minnesota among Somalians. In California, there's a big one. I think people get a lot of ideas about vaccinations that somehow there's a safety issue. The safety issue is in not being vaccinated.
So, you know, many people talk about public health being a really important sort of new or needing to improve approach to helping our country be healthier. But when you come down to it, other than clean water and clean air and starting to, you know, hand wash with surgery, really vaccinations are the most important ingredient toward public health. At least that's what I understand.
Absolutely. No, I think you're 100% on. So much of what we do that seems so important in the hospital. So I'm a pediatric cardiologist. Bill is, there are other ones probably in the room. You know, we take care of 5 out of every 1,000 live births. 10 out of every 1,000 have heart disease, but only about 5 need an intervention. Obesity is going to cause hundreds out of 1,000 to have diabetes and heart disease in the future. So these public health things like vaccination, weight management, social structure are way more important in the scheme of things. Not that we're not doing important things.
That's good. So let's expand on traumas just for a second. So I am really captured by work that the Kaiser Family Foundation did, and Mike Brumman just talked a lot about, and we've talked about as well, which are the kind of other traumas that children may experience in their childhood, the so-called Adverse Childhood Experience Survey. And this is a survey done by the Kaiser Family Foundations that looks at the influence of traumas, neglect, trauma, and family dysfunction on health in the future. And I don't know if you want to comment on that, Phil, and then maybe talk a little bit about the resilience factors that may be important in trying to help people that have suffered these kind of traumas.
So first of all, I'm a little embarrassed. I'm going to admit that I have learned more about this from you, Clay, than I ever knew. So I'm a pediatrician, but I'm a specialized cardiologist, and I thought I was doing well to worry about weight management and obesity. That really spread my wings. And then I was a chair, and I had to worry about endocrinology and emergency medicine and all that sort of stuff. But until I moved to West Virginia, even though these problems exist throughout Appalachia, they were in Ohio and they're in South Carolina, and you began to kind of inform me through many ways, including books that I needed to read, about this issue. It opened my eyes to a bigger issue, which almost everybody in this room takes for granted. We had mostly parents who cared about us. There are a few of us who could have had better parents, but most of us, they cared. We were their number one concern. We had food to eat. Even if they got divorced, they traded us back and forth and sent us to school and did all that stuff. But there are so many kids in this world who have sexual or emotional abuse, who in this state, I think it's Mingo County, 40% of the children have been in foster care at some point. That's an amazing figure. We have kids stuck in this hospital because we don't have medical qualified foster care for them. So they might live in the hospital for a year or two on a ventilator until we can find somewhere to take care of them. Those kind of things have just an enormous impact, and clearly in West Virginia they do. So, not easy problems, but my wife always likes to say, how do you eat an elephant? One bite at a time. So, Larry Rhodes, who does have some good characteristics, is our rural health person. He started a camp, Tomorrow Is Mine. He only got half the kids to come, but it was an amazing experience for those who did come. And next year it's going to be even better. It's 4 kids in that area. Give them good examples of how you can function in a normal family. He said a lot of the families didn't come because they couldn't get the kid there in a legal car. They had to rescue one family from the state trooper because the car didn't have the right kind of license plate or the tail light was out. So I think there are things we can do. Harder problems, we're going to have to work with insurers or be the payer provider, and we're going to have to develop programs that are individualized for different communities, kind of like what Larry is doing with Tomorrow Is Mine.
That's great. And just very quickly, this is a 10-question study. There's a great web presence of it from NPR. If you want to look it up, it's called the Adverse Childhood Experience Survey, ACE. So as Phil said, questions about like abuse, neglect, did your parents love you? Did somebody love you? Did you feel safe? Did you have a good community? And family dysfunction, did your parents get divorced? Did a parent get put in jail? Did you live with your parents? And if the answer to one of those 10 questions is yes, your risk of everything bad goes up. So your risk of obesity, diabetes, heart disease, cancer, addiction, overdose. If your answer 4 of the 10 is yes, your risk of emphysema is 1,200 times higher than if your score is 0. If your answer is 6 yes, you're likely to live fewer years, up to 20. And interesting, by county, parts of West Virginia have a lifespan expectancy of 20 years difference. So, and the offset, J.D. Vance, who wrote Hillbilly Elegy, had a score of 7. And the offset is resilience. And talk a bit about helping with resilience, which is really what you alluded to Larry's camp about.
Yeah. So I think the most important thing, as I understand it, for resilience is forming a close attachment with a mentor, parent, grandparent. And so I think that's the kind of thing that Larry's trying to do in Camp Tomorrow's Mine. I've been talking to Children's Hospital of Wisconsin, which runs their own foster care program, about how can we do something similar here. I mean, our state, it's not just the people of the state, it's the government in the state doesn't have resources. So people care, but there aren't enough resources to do the things we need to do. So I think there are things we can do. Those are those one bite at a time elephants, but for the elephant. But I think as we move forward into value-based and population health, and as we get our hands around working together closely with the children's hospitals in Charleston and Huntington, we can do more for families to help build resilience and emotional health.
Good.
Now, is the 11th question, do you fly a plane? On that sort of
With a parachute, luckily. The other thing that I would say is, as we look at the health problems we have, the opioid problems, many people talk about the social isolation that people might feel. So we know through every species, if you don't get love and touch and caring from your parents, your mother particularly, or you feel isolated or you get culled from the herd, that is very damaging to your social development, but also your health. Do you want to comment on that?
Sure. I think this is another place where best practices really can play a big role. How do you go into a county and create programs that bring the community together? It's not easy, but it can be done. We've got a lot of examples in Vermont and other places. Clay is way better at remembering these things than I am, so I'm sure he can tell you exactly which ones. But there are a lot of paradigm programs that I think as a state, we can throw the handful of marbles out there, let them roll, try a bunch of different things. It's things we've talked about with Benenum Foundation and other things. How can we partner? And one of the things I'm really impressed with, so we want to build a children's hospital, so we're talking to people about donating money. And what I found is that anybody who lives or has lived in West Virginia feels really strongly that they want to help the state. And it goes, sometimes it's $25, sometimes it's $1 million, sometimes it's $5 million.
I've got 40.
There you go. So, and I'm really impressed with that. And I think that's where a lot of this is going to come from, that when we go to people and say, here's a program we want to do, we're going to get funding, just like Larry did for Camp Tomorrow is Mine.
Talk about the children's celebration at the football game. I think it was only because of the reason that we had the game that we made the comeback we did last week.
So you just reminded me that on my calendar I had said, bring game ball. No game ball here. So marketing from the hospital, public relations, I think Bill Case even got involved from the School of Medicine, marketing from the athletics, Dana Holgerson, Shane Lyons, Gordon, Clay. A lot of people said, hey, when it came out that homecoming was going to be dedicated to children, that we really need to make something special of this. And it was a really great event. I got the game ball, which I'm not going to keep. I'm going to give it to the Children's Hospital. Accepted it along with Jeff Hostetler, who's been a huge supporter of the hospital. And for those of you who missed it, on August 8th, we dedicated the Jeff and Vicki Hostetler Family Resource Center, another gap we had. How do you take care of families in the hospital? Jeff and Vicki have been a family in the hospital on multiple occasions. They knew it was important. So Jeff and Brent Wilmuth, who's head of our leadership council, accepted the game ball. There were signs all over during the game. We had the kids led a cheer. We're going to follow up on that. We had patients, staff, and faculty on the field.
I mentioned the last part of it. We
We
back.
won.
Yeah, we won.
And because of all that, we won. And I think many of us who were at the game thought it wasn't going to happen. I've gotten to know Dana pretty well, and I really felt bad for Dana, but now I feel good for Dana.
Yeah, that's good. That's good. Lisa, you have a question.
Yes, I have a question.
And by the way, I also want to publicly recognize our own Lisa Costello, who received the Young Alumnus of the Year from the School of Medicine this past homecoming. Congratulate Lisa with me.
Thank you, thank you. There weren't many applicants, so they had to give it to someone. But former AAP President Bob Block said, all adults were once children, but despite the great efforts of many people in this room and on the stage, not all children become adults. Thank you for holding this forum to talk about that. So my question has to do with access to health care. So right now in the news, there's a lot about healthcare reform, and I don't think a lot of people understand the difference of children's coverage versus adult coverage. So Medicaid and the Children's Health Insurance Program, in the beginning of September, we held a policy summit with Senator Rockefeller and Sylvia Matthews Burwell about the importance of the Children's Health Insurance Program. It's expired. It's been expired since September 30th. So can you talk to the importance of these programs for access to children, particularly in West Virginia, where at historic highs for coverage for children, but if these programs go away, there's a big threat to children that could have a real impact. And then I'll just throw this out there, since you already have the superpower of flying, if you could have any other superpower, because I think our patients we care for are superheroes, and those who care for them are superheroes, real life superheroes, what would be your superpower?
Superpower.
Lisa's good. She should be up here.
Peace in mankind. No, let's see. I guess if I had superpowers, my superpower would be to address these semi-medical issues that Clay's referring to, as well as general health. That if we could create programs in schools and give physicians offices more time to do this and a little more money, that if we could really impact, if we really wanted to impact health, we need to look outside of the medical environment and work on those things. So I'll address your first question now. I'm going to have to think of a better superpower than that, but
I think like super strength or something might be better, but that's just me. Yeah, right.
Yeah, but you know, then you get old and you get ruptured disc. And
Yeah, I want to talk to you about Lyme's disease too before you finish.
Okay. So, extremely important issue. I think, you know, the fallacy that I see in Washington is that less money will buy more. And it doesn't work in my house. It doesn't work at this university. It really doesn't work anywhere. If you want health care, and if health care is a right, and I think all of us would think it's a right for children, then you got to put money into it. And the CHIP health insurance, the Children's Health Insurance Program, CHIP, which started in 1997 and was spearheaded by our own, partly by our own Jay Rockefeller here, has taken care of 20+ million kids that fall between the poverty level that gives them Medicaid and up to 300% of the poverty line, which is still, most of us couldn't live on that, and neither can they. So it's been an incredibly important program in terms of everything we've talked about today: vaccinations, mental health care, hospitalization, access to health care. If that funding is there, it means that institutions like us can hire more specialists to provide that access, that pediatricians can make a living in a small community through federally qualified programs or a Medicaid supported clinic. So it's just incredibly important to the children of this country that every child is covered. And it's been true for that 20+ years with children. It's only been true for the last few years since the Affordable Care Act and Medicaid expansion in the 27 states that have expanded for the last few years. So yeah, I think, and Lisa has been a tireless advocate with the American Academy of Pediatrics, as well as locally goes to Washington, lets our representatives know. So if you have any capacity to write a letter, go online, find our congressman. You don't even have to write it. You get a template and tell them how important CHIP is to you, to this state, incredibly important to this state, and really to the whole country. So thank you for bringing that up, Lisa.
And
Lisa.
This is a bipartisan issue. So
Bipartisan,
everybody
absolutely.
loves this.
I have a question for you.
Yeah, there's a library right here. We need all of the components from the library, right? I was referring to it.
Great, thank you. So one of the first things that happened when I got here was Dr. Marsh said, there's this woman, Lisa Costello, who wants to stay. We don't have a job for her, can you find something?
I think I more said find a job for her,
Find a
but
job
but
for her, yeah.
Whatever. How I
And,
said it's not important.
And we work together, and Lisa has a lot of her own needs, personal needs and other things, and wasn't sure, and we had to build a job. How's it worked out? Oh, good, good. Because
Parents
we're
are great,
glad you're
too.
here, Lisa. We're really glad you're here.
All right, so tell me about when you first came here. I met Phil for dinner. I said, "How you doing?" You go like, "I'm not doing very well." So talk about that.
Yeah, so I took some time off between Ohio State and here, and I had the good fortune, and I told you we have a cottage in Maine. I spent the whole summer in Maine. And the only problem with Maine is Lyme disease is endemic. And I'm like any other, the kind of super person I am is I cannot get infected by anything, right? Pediatrician, so I didn't wear any protection from it. And I thought I had, Lyme is mostly a 3-day flu-like illness. I thought I had it, but then it kind of went away, and I just had some night sweats, a little back pain. Finally got tested, got treated, but at the end of the treatment, I got a severe L5 radiculopathy. So sciatica, basically. Couldn't walk. I was disabled.
And you're a runner, so I mean, you were like
I was
really down.
in and out of the hot tub. I mean, I could barely move around for a month. And I knew I had to start the job. You know, so I didn't know when to say, I may not be there October 12th. This was 2015. And anyway, make a long story short, I got on some Neurontin, which helped me walk. I realized I had wasting of a whole bunch of my thigh. And when I got here, I saw Dr. Sarari. Is he out here? No, I don't see him up there. ID, because I knew I had Lyme disease, and I wanted to figure out, could this be from my Lyme? Because every doctor in South Carolina said, oh, you had Lyme, that's fine. Let me give you an injection. Let me do an MRI. They were doctors. They look at what they do. And I kind of figured out online that Lyme can cause this. Turns out it hides in your nerves even after oral. So the first day or second day I was here, I saw Arif. He agreed it probably was. We did some testing. Third day I was here, I got a PICC line. Went home to my hotel every night, hung the IV bag, ceftriaxone on those little bulbs where you close the door and you stick that thing in the door. That was my IV pole. 2 days later, I had no pain. That's awesome. And I recovered. So yeah, I was very happy for the healthcare here, and very happy to cure chronic back pain with ceftriaxone.
So the magic of modern medicine still has a role in our future. So we're about out of time. I can see that I'm getting the high sign. So Phil, why don't you leave us? I was going to do the Jeopardy round, but we'll save that for the next time. So why don't you leave us with your best thoughts for what a great future for children of our state and our nation would be?
I think it comes back to a lot of what we said, that it's not about sick care, it's about child health. And that if we're going to do that right, we need to do what a lot of health systems are doing. So Cincinnati Children's, Elisa helped us get a speaker for the last AAP meeting. They've taken on 35,000 lives in that area. And the most telling story they gave me was that they had a child who was in a wheelchair and mostly lived on the street. Well, what do you think happened with that child? She was in the hospital all the time. She had CP. So she did get pneumonia. She'd be in the hospital.
CP?
Oh, cerebral palsy from birth. So she'd be in the hospital all the time, a lot of healthcare dollars. Once they had full responsibility for her, they said, let's get them an apartment. Let's get them an air conditioner because she has asthma. Well, her healthcare costs plummeted. She went in the hospital once over the next 15 months.
And her quality of life?
And her quality of life, way better. So cheaper and better. We can do a better job than we do now by looking at the whole child and thinking about value-based healthcare, either doing it ourselves or having a partner. We need to be in the payer-provider business so that we can also not see somebody frequently to bring the cash register again and still help them be healthier.
That's great.
If we do that as a country, we'll be better off.
And I would just say my very last word, and then we're out, is the derivation of health. Do you know where health comes from, the word? Wholeness. So when you talk about the whole child, that's part of health.
I learned something new from Clay every day.
So thank you guys so much, and please help me congratulate Phil. And now we need to leave because there's a class coming. So.
Certainly.
Hey, 1, 2.